1.
Alrighty, my name's Carter Rustio. I'll be performing the male catheterization for this demonstration for the clinical skill that we were working on this past week. Before coming in and introducing myself to the client and letting them know the procedure I'll be performing, I want to check the order in my client's charts and prepare my materials with the sterile packaging, and then I'll need also a pair of clean gloves. But when I come in, I want to make sure the door is shut, or we have a curtain protecting the dignity of my patient as we proceed with the procedure. But then I would introduce myself to the patient and identify them with their wristband according to the procedure and policies of my place of work. But after which, I would first lower the bed, or the head of the bed, to client supine, and then I would raise the bed to a comfortable work position for myself. About a good height for me. I'm a taller individual. I want to keep my materials close to me because this is a sterile procedure, so I don't want to have to be moving around once I get my packaging open and make that sterile workspace. But as I begin to clean the area for the procedure, I want to continue to tell my client the steps that I'm taking, so they're aware what I'm doing and the purpose of which. So I would let my client know that at first I'm going to clean their genital area. And I do want to still keep them covered to my best ability, and only exposing what I'm working with. So I'm going to put on my clean gloves to do this part of the procedure. Cleaning the genitalia area, starting with the head. I'm going to make sure to get the entire shaft as well. And I've cleaned it. I'm going to let the patient know that I'm also going to place this pad under him. And if your patient is able to help, you might want to ask them if they can lift their bottom up so you can scoot it under, or even if you are finding trouble with that, you may want to ask a fellow nurse to help you lift the patient. But I'm going to work this under, and this protects the bed from being soiled throughout the procedure. Bed pad under my patient to protect the sheets in my bed from getting soiled. I clean the genital area. I'll recover my patient. Dispose of my clean gloves. And then this is the part of the procedure where I move on to the sterile technique. Opening my workspace. Now, right on top of my materials, I have my sterile gloves that I will first put on. If you're not fearful of your patient moving or bumping or breaking the sterility of your workspace, you can do this on the bed, as long as you maintain the sterility of the packaging. From here, I would first grab and pinch here, slide my first glove on in my dominant hand, hook in the other glove and work it on. These are size medium, so they do not fit my hands. So for the sake of video, I'm going to put on the gloves I had on earlier and pretend that they are sterile gloves and maintain that sterile procedure. Now that I have put on my sterile gloves, I'm ready to proceed with the catheterization. And now that I find myself in this situation, this is noteworthy. I cannot touch the my patient's gown or his sheets because I don't want to break the sterility of my gloves. So I'm going to ask my fellow nurse Amara to help me out and just expose him for the procedure as I get ready with my materials and tell him what the procedure is going to entail step by step. But first, I'm going to let my patient know that I'm placing this pad. And this is going to go over his thighs but under his penis, making sure I do not touch his thighs when I do so. Place so. This is a technical skill. That can take some practice, but let's say I was to accidentally touch my patient's thigh or the sheets or something, break the sterility, it would be okay. I would just have to restart the procedure with putting on a new set of sterile gloves. So I'm just going to expose only the area I'm working with. And this helps to prevent when I go to do the catheterization. I can set my hand here without breaking the sterility on my non-dominant hand because this surface is still sterile coming from my packaging. Now, I'm going to prepare my materials, my lubricant, and my cleanser. Sometimes the cleansers will come as swabs that you will clean the meatus with the swabs, or in our lab materials, it is the cleanser that you put on the cotton ball and then use the tweezers to clean. So I'm going to perform that skill, part of the skill next. There's my lubricant here. So now that I have my cleanser ready, tweezers and cotton ball. Get my cotton ball and my cleanser. Tell my patient that I'm about to touch the genital area to perform the cleansing in preparation of the catheterization. So I'm going to start center. And throughout this cleaning process, I want to make sure I get all the meatus ready and prepared for the catheterization.
If you use an old medication card, this rolls out.
Cleansings, I did break the sterility of this glove when cleaning the meatus of my patient, so I want to make sure that I don't compromise the sterility of any of my other materials. And I may have made a slight mistake in doing that with the cleansing. So from here, just to be careful and knowing my own technical skills as a nurse, I would not be comfortable performing the rest of the skill one-handed. So at this point, I would prepare another set of sterile gloves and place them on my hand to carry out the rest of the procedure. Maybe have my friend and co-worker nurse Amaria grab a new pair of sterile gloves for me that I could place on. So let's say I would dispose of these sterile gloves because I broke the sterility of them. I would open the new package and perform the same sterile technique in placing the sterile gloves. So from here forward, I have a new pair of sterile gloves ready for the procedure. Noting my mistake and keeping that in mind as a reflection for my next catheterization. For the male clients, especially because their urethra is longer, we're looking to insert the catheter about 6 to 8 inches. Our kit is not prepared with them, but in the clinical setting, you can take a syringe such as this one, filled with the same lubricant that I'm going to lubricate my catheter with, and take it and insert it into the penis and inject it into the urethra. And this makes sure that it, not only the lentis is lubricated, but the entire urethra, and it prevents damage throughout the procedure that the client will undergo. But after doing so,
read the label, read the second, read the label, third, read the damn label. Okay? You would be very surprised at how many medication errors happen just because people don't read the label.
now I'm going to
And then if we had another medicine, of course, we did that out with the same
now I'm going to prepare my catheter and lubricate it. Set my bag here. So pull this off.
usually
This
liquid medicine.
sterile pan.
Usually they come.
And for the sake of performing the procedure on the dummy, we're not actually going to put the lube on the catheter because that's not good for our mannequins here, but we're going to pretend like we lubed it up at least 2 to 3 inches. I'm going to set my sterile bag here.
The bottom of that little dip,
And once I place my non-dominant hand,
15 millimeters.
it has to stay here for the rest of the procedure. And as I work this in, I want to make sure that I'm not doing it too forcefully, and I'm going to insert it about 6 to 8 inches or until I reach resistance or urine comes out. And I will note that until I reach resistance, and reach resistance, or I hit urine withdrawal coming from the catheterization, which I would place into the my form of a catch. In this instance, it would be this container here, and I would wait until my client was finished with urination. And then upon removing the catheter, I want to make sure that it is continuous but not too slow. So as I retract the catheter, I will then want to dispose of all my materials, and then when doing so, dispose of this. I would then want to clean up my patient, reposition them, and document how much urine I got from them, how they tolerate the procedure in their chart. And I want to note a couple things that during catheterization, if the client seems to be struggling with retention or just excreting the urine from their body, you may want to press down on their bladder to help them throughout the process. And again, we just want to make sure that we are communicating with our patient throughout the procedure, and let them know what we're doing step by step to make them more comfortable. But after which, completing the procedure, like I said, we would reposition the client, perform hand hygiene, and document. And the last thing I want to note about this skill is you saw me make a mistake earlier of compromising the sterility of my offhand. And a more experienced nurse would know that it would be best to pre-lubricate the catheter and have it ready in their sterile space. Place the non-dominant hand here, clean, and then keep with your pre-lubricated catheter already. Keep your hand here to perform it. But I identified that mistake and was able to proceed through the procedure just with a minor extra step of putting on a new pair of sterile gloves. But that is the procedure of a straight cath on a male client.